What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID or any of the other viruses, I hope you have a full and speedy recovery with no long COVID issues and no long-term issues from those other viruses. It is time now for the Friday edition of the Virus Update for Friday, March 7th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed of what's going on with these viruses. A lot of people have gotten sick this winter. Hey, measles. Measles is something that was a big thing many years ago. We thought we had measles under control. Guess what? Measles is once again a problem. As you can see, our first story of the day today is going to be about measles, and our second story as well. Yeah, we have some breaking measles news today. Want to stay informed with all these viruses? Just subscribe down below. Help me reach my goal of 10,000 subscribers this year. Give this video a thumbs up. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several news stories to talk about today. I believe there's about 10 news stories we got to get through today. Then we do have some new data in from the CDC. And we may take a look at a little bit of wastewater data. We'll see. All right, starting off with this breaking news from measles. We have two breaking news stories. First off, a New Mexico resident has died of measles. What has happened was the New Mexico resident had died. Then they conducted a test on him for measles. Turned out he did have measles. So the cause of death, though, it is still under investigation as a result of that. And this is, once again, this is in New Mexico. So, yeah, not good. At the same time, that came out last night. We got an update on the measles count today, not only for Texas, but also for New Mexico. And this outbreak, which at this point, it may be connected. It's hard to say. Some are saying it's not. Some are saying maybe this is connected. There's various different information coming out from experts. But, yeah, nonetheless, the measles outbreak surpasses 200 cases in both areas. And I believe 198 of them, yes, 198 of them are just from Texas alone. This outbreak just continues to rapidly spread. It's continuing to get worse. I'm deeply concerned. We saw Miami this week. In Florida, there was a case of measles. Here in Pennsylvania, there was a case of measles. Up in New York State, there's a case of measles. Los Angeles, California, LAX had a case come through. Yeah, things are really starting to pick up the pace with measles, and I don't think it's getting better anytime soon. I think we're going to see more states start to fill in with measles cases. The question at this point is, how bad does this get? Hopefully, we can get this under control. But as of right now, it is not under control, and it continues to get worse. And I hate to say this, if you're in western Texas or parts of New Mexico, please be extra vigilant. I mean, it could be out there. And seems to be the majority of these cases so far are unvaccinated. There's a few of them, we don't know if they were vaccinated or not, but this is something that is really bad at this point, the measles. Something that was once under control. As of right now, it is not under control in the United States, and we really need to get an upper hand on this rather quick. All right, up in New Hampshire, tuberculosis testing underway after case identified in person at Manchester shelter. Yes, another virus that once was under control. Again, there are problems with this one. As you know, out in the Midwest, there has been a big outbreak, but random cases are popping up from time to time in other parts of the United States as well. In Caldwell County in North Carolina, they are seeing an uptick in pertussis, whooping cough cases. Health officials at the Caldwell County Health Department, CCHD, have noticed higher than usual pertussis activity, also known as whooping cough, reported in Caldwell County in the past few months. All pertussis cases in Caldwell County have been handled, investigated appropriately. In response to this increase in cases, CCHD is educating the community about symptoms and urging everyone to get the vaccine if they can. So yes, more of an increase in Caldwell County this time. And also, continuing on with this, Wake County, I believe this is also North Carolina. Might be Raleigh area. Yes. Wake County confirmed a case of pertussis, otherwise known as whooping cough, at the Oberlin Magnet Middle School. Parents were sent a letter Thursday stating that there was a confirmed case of the highly contagious disease. The exposure occurred sometime between February 13th and 18th, according to a letter sent to potentially exposed students by the Wake County Health Department. So that's never a good thing. I'm going to make sure this one makes it into the school illness outbreak thread over on my site at datareport.info. Here is another story that is going to make it there. This is not good either. Whooping cough case confirmed in Central Washington University rugby team. Yes, a college sports team. Now, remember we had some issues. I forget what it was. Was it whooping cough? Something else? There was an outbreak about a month or so ago with a team. I believe it was in the Pacific Northwest, maybe in Washington State. And let's read some of this. A confirmed case of pertussis is associated with the Central Washington University rugby team. And it looks like they are working to potentially stop the spread, but this is not good. And it sounds like all the players are going to be tested for whooping cough. Now moving on to this. Arkansas, also not good news. And in Arkansas, they are reporting that flu activity, it's still there. Arkansas Department of Health reports flu activity with 107 recorded deaths this season. Yeah, that seems like a high number for Arkansas so far this season. Little Rock, high flu activity is being reported by the Arkansas Department of Health in its latest report that was released on March 6th. But mind you, we are going to see a new update from the CDC in just a little bit. COVID-like illness, CLI, visits were at 1.76 in the emergency departments, and respiratory RSV was at 0.36. But get this, for this past week, hospital emergency department visits for influenza-like illness were recorded at, wow, 6.12%. That's bad. According to Arizona Department of Health, ADH, 11 COVID-19 related deaths were reported in that span. So in the last week, they've had 11 COVID deaths. Since the beginning of this year, there have been 85 COVID-19 deaths in Arkansas. Always good to see what's going on with some states that we don't always get some news about. All right, we got to go back to Washington again. King County. Public Health reports first pediatric flu deaths of the 2024-2025 season. Public Health has learned that 2 children in King County have died from complications of the flu. The first child was an elementary age child who passed away on February 14th, 2025. The second was a preschool age child who passed away on February 21st, 2025. These 2 unconnected cases are the first 2 recorded pediatric flu deaths this season in King County. King County has not had a pediatric flu death since the 2022-2023 flu season, meaning they didn't have one at all last year. So, yikes, this is not good. And it continues with the theme. We've been seeing many states reporting pediatric flu deaths. I don't know how many states total have them, but it's quite a few. It seems like it's a rather higher than normal number. And if it does to you, it's because there just has been so many flu cases this year. No, flu has not gone more severe. We don't know if flu has mutated or anything, but it's just there have been a lot of flu cases this year. And when you get a lot of cases, things that you don't usually see happen that could be rare to happen with flu can happen because the number of cases is higher than what we have seen. Alrighty, over in the Philippines, a ban on poultry imports from 3 U.S. states. That's right, they are banning poultry imports from 3 U.S. states due to bird flu outbreak. Yeah, this is pretty significant, and it just shows other countries are not messing around. They're not going to take a chance because they know here in the United States, bird flu is just oh so bad. You know what? We should just be honest. There's a lot of viruses doing bad. I hate to say it. Here in the United States, we're doing just about the worst when it comes to all these different viruses. We really are just a cesspool of viruses in the United States, right? It's sad. I mean, we should be better than this, but we're not. And here we are. We're in these big messes. Flu's out of control. Flu, I mean, it's finally getting better. TB, measles, bird flu, you name it. And bird flu is not getting better. It's the regular influenza that is getting a little bit better. You'll see that in a little bit. COVID-19 hospitalization linked to long-term organ damage and mortality. This is really nothing new. It's referring to something that we've seen before. If you've gone to the hospital for COVID, or let's just say you've had a severe case of COVID, yes, it can damage your organs. One of the ones that really comes to mind for me is It can cause you to have lung or breathing problems. Like me, I now have a little nodule on my lung from case number 1 back in 2020, my unconfirmed case back in 2020. It caused something that then went on to lead to asthma. And there's a lot of people, that get severe COVID and then something is damaged, whether it be heart damage, lung damage, brain damage. Golly, let's hope I don't have brain damage. Had my MRI the other day. Don't know the results of it yet. I will find that out next week. But yeah, a lot of people have various different issues and long-term organ damage afterwards. And sometimes those long-term organ damages can lead to new problems. And, well, as you see here, mortality can come into play as well. Yeah, it's very sad, but it is true. And before someone starts typing down below, oh, there's another ad. Trust me, I've tried to fix that problem. By trying to fix that problem, some of these news sites that we go to say, oh, we don't want you viewing our site. Sorry, you can't view this news story unless you turn off ad block. It's a problem. Maybe there's another way around it. I don't know, but that's the issue with that. We put up with a little bit of ads and move on. Healthcare is so expensive in the United States. Yes, it is. Americans borrowed $74 billion last year to cover their healthcare costs. And you know what? Before reading on, I can just tell you right now, locally, we're having a big problem. There are clearly people here that can't afford to pay their medical bills. Why do I know that? Well, we have 2 hospitals in Chester County, Pennsylvania, that are not Chester County. I keep saying Chester County, Pennsylvania. It's Delaware County, Pennsylvania, in the city of Chester. In that area, there are 2 hospitals that will be closing from Crozier Health because the health system cannot physically go on. But at the same time, in the report, one of those hospitals is close to being full. Staff members say it's close to being full. And we know, and there's been stories over and over again about this, about some people having difficulty paying their hospital medical bills. Yes, it is a real problem, and it is really expensive. To go to a specialist is really expensive. Let me tell you something. I had to have that MRI done this week, and what was my copay? Yeah, this is with healthcare insurance. I think it was $271. That is ridiculous. No one should have to pay high medical bills, especially, when you're dealing with something such as long COVID, as is, there's some people that can no longer work. They can't afford these high medical bills. And look at this. Americans borrowed $74 billion last year. We really need to get this down. Let's read some of this. Healthcare is so expensive that 31 million U.S. adults, or 12%, had to borrow a total of $74 billion last year to obtain medical care. New data shows that includes people with health insurance, making such numbers even more troubling. I just gave you my report, and I'll tell you what, I'm going to let you in on a secret. I'm going to let the cat out of the bag. I'm going to be going to another specialist. One that I've gone to before, but for a new issue. I'm going to be going back to my pulmonary and sleep doctor. Yes, I go there for asthma, but also going there for a tiredness issue now. Yeah, I got the referral in the mail yesterday. I was reading it. Oh, sleep apnea. Oh, snoring. And my doctor also put on there, he wants me checked for chronic fatigue as well. So, yeah, let the cat out of the bag. Wasn't going to say that till next week, but the point is, to go to a specialist, that is $150. So I'm telling you, even some people who have healthcare insurance, like myself, it still costs a heck of a lot to go and see people. And that's if you can get into a specialist. I think I'll be able to get in now. He's taken on more doctors, but who knows? Maybe it'll be a long wait. Almost 1/3, more than 3,500 people served by Gallup and West Health, a group of nonprofit healthcare organizations, said they're very concerned that a major health event would lead to medical debt, despite most of them having some form of healthcare coverage. And yes, this is a real problem. There's a lot of people in medical debt that can't afford to pay their hospital bills. And because of that, some hospitals and some healthcare systems are having financial problems within themselves. It's really bad. All right, let's move on. I could make a whole video just on that issue. I talked about it the other day. I think down the line, we probably will do a video on that issue when things get slower. COVID-19 is moderate, flu A is high, flu B is moderate, and RSV is moderate. This is in Canada at this time. If I forgot to say that, I apologize. These are the levels of the viruses in Canada. Taking a look at what is going on with air qualities today. Let's check that out real quickly, if we can. You see it was all gray, and it's been stuck on gray. All right, very good. Green showing up in the northeast. Is the rest of this map going to load? Yes, I think it is going to slowly load. A little bit of a problem area over the Great Lakes. Not terribly concerned about that. There's a little disturbance going through there. Some moisture sometimes, as I stated this before, moisture sometimes triggers these centers to show some bad air quality, and we can't see the west coast. There it goes. San Francisco area looks to be a little bit of a problem. Los Angeles, a few minor problems, and the rest of the areas are okay. Vancouver, Canada, a little yellow for you. I'm not really sure what is going on there at this time. And let's refresh this. There we go. Pinellas County in Florida. We do see a few calls at this time. And it looks like I do need to put up Philadelphia's EMS number for today. Let's see what it is. On Thursday, 816 EMS incidents were reported in Philadelphia. We still do not have an update on the flu numbers for Philadelphia. I honestly don't know when we're going to get it at this point. And oh my. Wow, look at all these calls in Montgomery County, Pennsylvania. 21 right now? Why so many calls? All right, I'm seeing vehicle accidents show up once, respiratory emergency, nauseous and vomiting, cardiac emergency, fall victim, cardiac emergency, vomiting again, another accident. Just a wide range of calls. At least we don't see cardiac arrest. That's good, but yeah, I don't like seeing that many calls, and I hope things are, well, no, not much better in Chester County. Respiratory emergency, look at this. Not once, not twice, 3 times for that. Heart problems, emotional disorder showing up a few times, stroke, hemorrhaging. Yeah, this is pretty bad at this time. And you know what? Hemorrhaging's been popping up more. Did we or did we not share the story? I'm going to tell you a story real quick. It was on the news. I don't think we shared this. There was an Uber driver in the Philadelphia area. He picked up a rider, not terribly far from where I was, because the hospital's not far from where I live. But he noticed something wrong with the rider, and he kept saying, "Are you okay?" And right away, he thought, call 911. Turns out the rider was going through a hemorrhage. And that's what they found out at the hospital. They're saying it's an issue that the hospital's saying it's an issue he may have had for a very long time. I don't know whether he did or not. I also question, did he ever have COVID? Now, someone's probably saying, stop linking everything to COVID. Not everything's COVID. Do you know that? Do you know if he's had COVID? Because there are many studies that prove COVID causes brain damage. And what if he was perfectly fine before, and now all of a sudden they're saying, oh, well, if you had this, if he's had it forever, or for all of his life, wouldn't he have noticed problems? I honestly do not know. Again, I'm not a medical professional. I'm just observing things. I'm just reporting on what I hear and see. Maybe we'll make sure we get that story in the next update to just show it to you. Hospital situation in Pennsylvania. Not terrible. There are some yellow hospitals showing up here. We have seen worse. Look at that, South Central Pennsylvania. All green. Lehigh Valley, still some problems. And I do want to show you something real quickly. Here's the one hospital, Crozier Chester Medical Center. And here's the other one, Taylor Hospital. Take a look at this. These 2 hospitals right here are the ones that are going to be shutting down unless someone from Pennsylvania State Congress or State Senate or somebody steps in. Look at that. So you're losing 2 hospitals right there, right? And take a look up here. Springfield Hospital has no emergency department. Then you get Mainline Health Riddle Memorial Hospital. I don't know what their capacity is. Then you go all the way out to Westchester. Then you come down Delaware. Nothing in between. You have a huge gap here. And now you're about to have a huge gap here. This is really bad, folks. And if they're saying one of these hospitals is close to being full, this is crisis mode for this area, as is Delaware County, Pennsylvania. Just finally, I think it was last year, finally got a Department of Health. So this is not good news whatsoever. Let's see what's going on in New Jersey. And we can see here, New Jersey has a few hospitals with issues, but nothing really terrible at this time. All right, moving on. We do see no beds listed for critical care. That's not a good thing. Jefferson Stratford Hospital and Jefferson Washington Township Hospital. All right, moving on now. Speaking of New Jersey, taking a look at what's going on with the COVID situation in New Jersey. And we can see COVID cases in New Jersey at this time didn't really drop much from last week. They did a little bit. 1,627 new cases have been reported. Taking a look at what is going on with influenza, if we can. It's loading really slow. All right, there we go. When it comes to, no, that's COVID-19 again. We want influenza. There we go. And influenza at this time does appear to be continuing to drop steadily. It was dropping rapidly And you know what? It still is dropping very nicely at this time. But they did add another 4,898 cases. That is much lower than the 5,900 that New Jersey had last week. Let's see what's going on with RSV at this time in New Jersey. And clicking on that, we can see RSV, I believe, is continuing to drop. Yes, RSV is really dropping at this time. 2,214 new cases added for that. And that is still RSV, right? Wow, that seems like a high number. Yeah, that's all right. Wow. Okay, this is RSV number of tests performed. I have to make an apology to you. I was about to say, that's really a high number of cases, which it's not. It is a 2% positivity rate in RSV in New Jersey. And influenza, that was the number of new influenza cases that we saw. All right, moving on to New York State. You can see in New York State, 1,140 people have tested positive. When it comes to the hospital situation, yes, hospitalizations did go up today, but it's not because of New York City. I believe I looked at Central Region New York, and they did see an increase. There were a few regions that saw an increase today. Let's take a look at this. And the hospitalizations in Central, yeah, there you go. It went up to 32. Yesterday was down at 21. So while that's, I mean, it's an increase, it's not a huge number, but there were a few sections of New York State that rose. And again, statewide level, 750, 74 people in the ICU. I think they will continue their trend downward next week. All right, skipping over wastewater because I have gone too long here. Taking a look at what's going on with some CDC data. We'll take a look at some of it today and the rest of it tomorrow. The LP 8.1 variant is at 42% this time. That is the leading COVID variant. This is very important to look at. Really good news. Take a look at the influenza-like illness activity map. Yes, you're not seeing purple anymore. You're seeing less in the way of these very high levels. Things are starting to drop. Let's go backwards. We can see here. Look at this. You can see it's starting to improve. There's light at the end of the tunnel. The winter wave of these viruses is finally starting to slow down. I hope this continues. I hope we don't see a flu resurgence in spring. In rare cases, it can happen, but right now things are starting to trend downward. Still very high in Michigan, Ohio, very high in New Hampshire, very high in Maine, Massachusetts, South Carolina. South Carolina's gotten hit oh so hard this year. Louisiana, New Mexico, and Washington. Then we have several states that are still high. Then we have moderate. And we even have some that are in the minimal category now. Yes, North Dakota and Oklahoma. And yes, even up in Montana, things are now down to minimal when it comes to influenza-like activity. Isn't that some good news? All right, skipping over all things wastewater, let's take a look at this. I do need to refresh this because I don't think it was up to date. There we go. I believe it is now. And these are the percentage of emergency department visits diagnosed with COVID-19 in the United States. You know, people that show up to the emergency department with COVID. And we can see it's down to just 0.74%. That is really good. We'll go state by state at some point over the weekend, whether it be tomorrow or Sunday or maybe even Monday. Probably not tomorrow, because I suspect CJS is going to have his double header today, or however he's going to do it. And I also suggest that we may have quite a few news stories today, because it's 2:50 on a Friday afternoon. As you know, sometimes Friday evenings, a lot of news stories pop up. So we will see what happens. Alrighty, folks, we're going to stop it there. We still have Colorado and some other stuff to take a look at tomorrow. So tomorrow's going to be a pretty loaded video, I can already tell. If you enjoyed this video, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. A quick note about comments. If you do not see your comment posted, there's a reason for that. Sometimes people think, oh, I'm shadow banned. Yes, YouTube can go and do that on their own. I don't do that. I have my comments set to approval. In other words, before the majority of the comments appear, I have to approve. There's some that automatically approve. There's some that don't. And there's a reason why I do that. I don't want my comment section to turn into a trash can. Because we had that problem back last year. I forget when it was. At one point, and I said, you know what? Why don't I just approve all the comments? And I'm slowly adding more and more people to the auto approval. If you're not on there, you may make it soon. If you're a regular commenter, and I don't have you added yet, you probably will, and your comment will go through right away. But I'm going to be working today, so you may see me slow to approve some of these comments. Alrighty, folks, I will see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Friday evening, and have a fantastic weekend. Thanks for watching.